advancing another 1 to 2 millimeters before pausing once again. It should take anywhere from 6 to 10 seconds to reach bone, depending upon the thickness of the palatal tissue. Maintain the needle bevel against the surface of the bone once it is contacted. You should begin to notice distinct blanching of the palatal tissue as an effect of the vasoconstrictor in the local anesthetic. This is normal. Once you have delivered the required volume of anesthetic, you can remove the needle. To avoid anesthetic solution spray back into the patient's mouth, do the following. While the needle is still embedded in the patient's tissues, depress and release the foot control pedal. Count 3 beeps upon releasing the pedal, and then remove the needle. Direct the needle away from the patient as a small amount of anesthetic solution may still be present. The AMSA injection is very useful for those dental procedures performed in the maxilla. It effectively provides profound soft tissue and pulpal anesthesia of multiple maxillary teeth from a single injection without producing collateral anesthesia to the lips and face, thus allowing greater post-treatment comfort. Additionally, those procedures that require a more accurate assessment of the patient's smile line during treatment, such as aesthetic restorative dentistry, can be accomplished with this maxillary injection technique with no collateral anesthesia. The palatal anterior superior alveolar nerve block is an easily administered injection that allows the operator to achieve bilateral anesthesia of the maxillary incisors and canines from a single palatal injection. The PASA is an excellent alternative to administering multiple buccal and palatal infiltrations in a highly sensitive premaxillary region when you need to achieve pulpal anesthesia to the 6 anterior teeth. Let's discuss how to begin. Before you begin, verify that the STA system is set to the STA mode. It is recommended that you use the STA wand handpiece with a short needle for this injection. Please note, it is important to use the STA mode for this injection to ensure that a safe and controlled flow rate can be maintained throughout the injection. Delivering the anesthetic at a faster rate may result in adverse tissue reactions and/or tissue damage. Make certain the aspiration feature is on, as aspiration should be performed during anesthetic delivery. This injection is initiated just lateral to the incisive papilla along the incisal groove while targeting the underlying incisive canal. The objective is to gain entrance into the canal and to maintain contact with the surface of its inner bony wall. Start the PASA injection by using the pre-puncture technique. Gently place the bevel of the needle against the surface of the incisal groove. Stabilize the needle by applying pressure from a cotton applicator. It's best to use a wooden handled cotton applicator so that adequate pressure can be applied. The applicator absorbs any excess anesthetic and makes for a more comfortable needle entry. You will now initiate cruise control by pressing the foot pedal and counting 3 audible beeps. After the 3rd beep, the STA system will announce the word cruise. On hearing this, remove your foot from the top of the foot control pedal. You will find that the STA system will continue to beep, indicating that the anesthetic solution is continuing to flow. The technique of allowing anesthetic to contact and diffuse through the outer layers of tissue will produce a topical anesthetic effect, numbing the surface. Don't puncture the tissue at this time. Continue to allow the needle to stay on the surface for another 4 beeps before initiating tissue penetration. Rotate the handpiece back and forth with a slight forward movement to allow a shallow puncturing of the tissue to a depth of 1 to 2 millimeters. Then stop forward movement to allow the STA system to continue to deposit anesthetic for an additional 4 beeps before any further penetration of the tissue. Continue to very slowly penetrate the palatal tissue with a gentle back and forth movement while simultaneously advancing another 1 to 2 millimeters before pausing once again. It should take anywhere between 8 and 12 seconds to reach bone, depending upon the thickness of the palatal tissue. Maintain the needle bevel against the surface of the bone once it is contacted. You should begin to notice a distinct blanching of the palatal tissue as an effect of the vasoconstrictor in the local anesthetic. This is normal. The PASA injection is very useful for those dental procedures performed in the maxilla. It effectively provides profound soft tissue and pulpal anesthesia of multiple maxillary teeth from a single injection without producing collateral anesthesia to the lips and face, thus allowing greater post-treatment comfort. Additionally, those procedures that require a more accurate assessment of the patient's smile line during treatment, such as aesthetic restorative dentistry, can be accomplished with this maxillary injection with no drooping lip. The STA system allows you to perform the new STA intraligamentary injection, which is significantly different than a traditional PDL performed with either a dental syringe or a high-pressure syringe. The traditional PDL delivers a low volume of anesthetic under high pressure. In contrast, the STA intraligamentary injection can deliver a larger volume under minimal pressure and thus provides a more comfortable injection with a longer duration of profound anesthesia. The dynamic pressure sensing technology designed into the STA system allows you to have continuous real-time pressure sensing feedback during the injection. The STA system will assist you in finding the optimal injection site to place your needle by offering audio and visual confirmation. It will also maintain controlled pressures below the patient's pain threshold. Let's discuss how to begin. When performing STA intraligamentary injection on multi-rooted molar teeth, it is recommended that 2 sites be used. Starting the injection on the distal lingual of this tooth, followed by a second injection on its mesial lingual. For maxillary molars, it is recommended that you initiate the injection on the distal buccal root, followed by the mesial buccal root. When performing an STA intraligamentary injection on a single-rooted tooth, you need use only a single site to perform the injection. It is important to have easy access of the needle into the gingival sulcus. In difficult areas, to improve accessibility, shorten the STA handpiece by breaking off a section of the handle. It is sometimes necessary to bend the needle, but not more than 45 degrees towards the handpiece, to allow access to the distal of mandibular molars. The needle bevel should face the root surface, as this will help during entry into the sulcus. While holding the handpiece in a pen-like grasp, approach the tooth at about a 45-degree angle with the bevel towards the tooth. Slowly place the needle into the gingival sulcus as if it were a periodontal probe. Simultaneously initiate the cruise control by depressing the foot pedal and counting 3 audible beeps. After the 3rd beep, the STA system will announce the word cruise. On hearing this, remove your foot from the top of the foot control pedal. Advance the needle forward slowly into the sulcus. Move the needle gently down into the sulcus until you feel resistance. Maintain approximately a 45-degree angle while holding the needle in place. Do not use excessive pressure on the STA wand handpiece. Carefully control and stabilize all needle movements with a finger rest. Once you feel you are at the base of the sulcus, you need to minimize movement for 10 to 15 seconds as pressure sensing technology starts to analyze your position. The visual pressure sensing scale is comprised of a series of orange, yellow, and green LED lights. As the STA system senses pressure building, you will see the sequential illumination of LED lights on the front of the unit. After 20 to 30 seconds with the needle located in the correct location, you will hear the STA system announce PDL, PDL, indicating that the proper pressure is being maintained and you have identified the correct needle position for that injection. A successful STA intraligamentary injection can occur in either the high yellow or green LED zone, as both are indicative of the PDL tissue. The STA intraligamentary injection is virtually painless and is ideal for single-tooth anesthesia in either the maxillary or mandibular arch, providing profound anesthesia without collateral numbness to the face, lips, or tongue for procedures of less than 1 hour. As we have seen, the C-Clad system achieves a true technological advantage for dental injections, resulting in a safer, more accurate, and more comfortable dental injection for your patient.